I thought, Tyler,
Yes.
I'm going to ask
Sure.
you
Yeah.
about turmeric
Yes.
because we get this information and we think, oh, we can just put a little bit, in our vegetables each day, and we're going to have all these amazing benefits, because there are some incredible benefits of turmeric. But to actually get those benefits, we need some information that you can provide us with.
Yeah, it is. I would say probably the #1 most confusing discussion that I have with customers on a regular basis is turmeric. Not only because the information can be misleading, but you have situations where a lot of research on turmeric started from, like we were talking about earlier, observational studies where researchers would notice correlations between populations that consume lots of turmeric, like Indian population for instance, and reductions of certain disease. Same with like green tea and other things, and they go, that's interesting, let's look further.
And that's where it starts,
that's
right?
Because
they see these trends in these areas where they consume a lot of one product.
And make sure it's not just some sort of coincidence. Make sure that maybe the two things are related somehow.
Right.
So the issue that's always been a problem with turmeric is it's delicious and it still has huge health benefits, is that the absorption and excretion problem has always been a huge concern. The absorption of turmeric is not that great. Specifically curcumin, which is the active ingredient in turmeric that gives it its yellow color, that does most of the health, the healing effects. Not that
this is
good.
what I bought.
Yeah.
This big bag of turmeric, thinking, whoa, I'm doing well.
It's very good.
But
you still get some benefits.
You will get some benefits, but to get really amazing benefits, you would have to
consume
the whole bag.
Quite a bit. So
a day.
So there's been studies that use up to 12 grams, which is about 4 teaspoons, where they do notice an improvement in blood levels. Like they'll notice.
So so 4 teaspoons would be the minimum.
Yeah, that's kind of where you start to get there's a showing, and even before that, you would still have something in your bloodstream. It would just be not nearly 12 grams. Like it's a small percentage of what you actually consume, and then only a small percentage of turmeric, about 3%, is actual curcumin. So there's other good stuff in there, but the actual curcumin, which is the active ingredient we're talking about, is about 3%.
Okay. So and that's the key.
That's the key thing that you should always look for.
Okay.
Now, supplements have changed a lot in the last 5 years. Even if you go back, I think of when we opened our clinic only 5 years ago, the best supplement we had would be not even worth even at all buying these days.
Wow.
It's just become so out of date so quickly.
It's incredible. So taking a supplement in the sense of when you come to something like turmeric is smart, because it's formulated the way it should be for us to get the best results.
All of the research as far as turmeric supplements has been on increasing the absorption. We know that turmeric does something, curcumin specifically does something, but it's all been about getting the absorption much, much better and sort of bypassing your liver's metabolisms, because your liver excretes curcumin very, very quickly. So the two things that have been mostly done are, one, they concentrate the curcumin. So some supplements like these guys, for instance, they will basically concentrate the curcumin so that one small capsule is equivalent to about 4 grams of actual turmeric spice. So that's good, but that's still not amazing. What they do beyond that then is they usually either do one of two things. They emulsify, so they sort of create an emulsified suspension with lecithin and phospholipids to create better absorption. That's the most common method, and the even more newer method of doing it is they make a water-soluble preparation, which is unheard of.
Okay, so that's the difference, right?
Yeah.
In just taking it as a spice, using it in comparison to taking something like this where they formulated it so that it's got the higher percentage so that it will be absorbed.
It's almost 300 times better absorbed, which is outrageous. It's true.
Yeah, that's incredible.
They've basically, to put it in a nutshell, and this is bad math, but basically the way you'd work it out is a single capsule of something like this, in terms of the blood levels achieved of curcumin, would be theoretically similar to taking 2 bags of this, which is about 1.08 kilograms.
Wow.
It's kind of what it amounts to, which nobody would ever do.
No. And I guess, too, we could talk that if you were to use turmeric on a daily basis and just sort of include it in your diet, there are going to be benefits from that.
Absolutely.
But to see the significant benefits, you would want to move to something like a supplement. That's what you were looking for.
Exactly. I would say from a therapeutic standpoint, so I think of green tea, for example, right? There are supplements with green tea that have, they're equivalent to 10 cups of green tea. So for the antioxidant benefits, you can, if you want, take a supplement from green tea, but you're still going to reap the benefits of just drinking lots of green tea, and that's how I do it. I don't take a green tea supplement.
Yeah.
I still would use turmeric. I still love turmeric. If I wanted the cancer prevention effects of it, or if I wanted the antioxidant effects of it, it doesn't hurt to add it to your diet.
Right.
But if I wanted anti-inflammatory,
we had the key important features of turmeric up there, and sort of how to work it into your system. But if you're eating well overall, and you're eating everything you should be in your diet, your greens and everything like that, you wouldn't necessarily need to go to something like this.
No, the only time, like from a practical standpoint, the only time that we really recommend someone take a supplement of turmeric is either they want a really good anti-inflammatory, where I don't think taking the spice will cut it for most people.
Right.
So they want a good, therapeutically effective anti-inflammatory, or
to help with pain and other issues.
Or they're using, like, they want a serious cancer preventative or a complementary therapy to cancer treatment, where it's like, you know, it's more of a serious sort of approach to take from a strategy. Yeah.
Fantastic. Great way to, you know, explain it, because I think that we understand, like, there's some good things, but you have to understand what that then's doing for the body.
Yeah.
And that realistically, yes, like if you want the true therapeutic side of it, a supplement is where you would have to go to really see it, but to include this in your life on a daily basis is good.
And when you're looking at a lifetime, right? Like, they look at age-related disorders like Alzheimer's.
We'll put your board up as you're finishing, we've got to go. But
you know, people have been consuming it for decades of their life, and they're noticing the benefits over a lifetime of consumption.
exactly, which I think is key. Thank you so much.
Thank you.
Always fun having you on, Tyler. Don't take my turmeric.